probably the most important portion of this lecture. So take your time. You can re-listen to this. If you have questions, reach out to me. There's too many people suffering with chronic conditions that never have had the investigation to figure out what the heck is going on. So if you're going to look at this slide right in here, okay, so let me orient you on what you are looking at right here. So this right here, this is the total white blood cell count right in here. So you see this? This is normal. So the white blood cell count is normal in here, right? This would be basically, this is the, if you remember the sweet spot, I like it to be 5.0 to 6.5 right here. And this right here is basically, it would be 5.4. That's the reference range there. So if you look at this, the white blood cell count is within normal. And now we're specifically just looking at your lymphocytes. And your lymphocytes, remember, have a whole bunch of different subcategories. Now check this out. You see this right here? All these are the different subtypes that you can have. And then look at, you can have high, low, and then you can have in range. Now all the subsets, look at this person here, has 1, 2, 3, 4, 5, 6, 7, 8 subtypes that are high, and he has 1, 2, 3, 4, 5 subtypes that are low. So what is that telling you right here? This is telling you that his white blood cell count, specifically the lymphocytes, are way out of whack. But if you would have done just a $5 white blood cell count, it would have came back normal. This is where you need to do the investigation to figure out. This is why people come to me and I do a guided plan to figure out exactly what is occurring with the immune system. And this is just one component of all the different things that we do.